Hello students, today I am going to discuss about postpartum or puerperial psychosis. So starting with introduction first, postpartum psychosis is a severe mental illness which develops acutely in the early postnatal period. It is a psychiatric emergency. Identifying women at risk allows development of care plan to allow early detection and treatment. And management requires specialist care. Health professionals must take into account the needs of the family and new baby as well as the risk of the medication while breastfeeding. Okay, so postpartum psychiatrics means if the mother have any mental illness during the postnatal period is called as postpartum psychosis. Okay, next we have definition. Postpartum psychosis, also sometimes referred to as puerperial psychosis or postnatal psychosis, okay, it is same thing, is an acute mental disorder or a psychotic reaction occurring in a woman following the childbirth or abortion. The episode of psychosis usually begins 1 to 3 months of delivery. Next we have incidence. So it is more common in primiparous than multiparous women. Primiparous means the woman who is having or who is delivering the first baby. Okay, multiparous means woman who is having more than 3 baby. Okay, so it is more common in primary mothers than the multi mothers, and it occurs in less than 1 or 2% in 1000 delivery. Okay, the incident rate is 1 to 2% per 1000 delivery. Onset abrupt, especially within about 3 to 10 days after the delivery or 3 to several weeks after the delivery. With proper care, most women are able to recover from their disorder. Okay, if you give proper care to the patient with postpartum psychosis, they will be able to recover their disorder. Then we have causes or etiology. The precise cause is unknown. However, the following severe as a risk factor to the development of the postnatal psychosis. It means the exact cause of postpartum psychosis is not known. Okay, but we have some risk factors that can associated with postnatal psychosis. The first one is genetic or hereditary disorder like chromosome 16, hormonal changes like estrogen and progesterone, and family and personal history of depressive episode. Okay, if the woman have anyone in their family who is having the depressive disorder history. Other causes like lack of social and emotional support, death of loved one, lost sense of self-esteem due to a woman postpartum appearance, feeling inadequate as a mother, financial problem, major life changes such as moving and starting a new job. Then we have poor marital relationships, single parents, child care stress, prenatal anxiety, low socioeconomic status, prenatal depression, unplanned and unwanted pregnancy, infant temperament problem, substance abuse, family history of mental illness, labor pain and infection. Next we have signs and symptoms of postpartum psychosis. The first one is hallucination, especially auditory hallucination, commanding the patient to kill the baby. Delusion, example, baby is Mesha or an embodiment of evil. Okay, which means they will think baby is a Masiha, okay, or it's sent by evil. Then illogical thoughts, insomnia, irritability, confusion, memory impairment and disorientation, sadness, crying spells, fatigue, exhaustion, hesitation, feeling of anxiety, extreme fear and ecstasy, irrational guilt, mutism, stupor and catatonia. These all are the things you have studied in psychiatry. Next we have complication of postpartum psychosis like suicide. Infanticide means they will try to kill their baby. Homicidal thoughts, lack of normal mother-infant bond, that is difficulty in caring for the baby, and marital and family problems. Next we have management for the postpartum psychosis. It is rapid and immediate hospitalization if she is thought to pose a threat to baby and herself or others. Like if you see that she is having any thoughts of killing herself or giving harm to baby, okay, in that case you should give rapid or immediate hospitalization for the patient. Medication or pharmacotherapy like antipsychotic drugs, antidepressant drugs or anti-anxiety drugs, psychological counseling or psychotherapy, education for mother and family. Okay, it is needed, like for the family member also it is needed to give the counseling and education. Family, husband and social support group therapy, establishing contact with other mothers, electric convulsive therapy or ECT, provide adequate rest, adequate nutrition, child protection service may need to be alert, and discharge should only occur with close follow-up in place. So this is all about the postpartum psychosis. If you have any doubt, you can ask. Thank you everyone.